Hi there, I'm Tamara and welcome back to another video based on wellness, psychology, and all things mental health. Today's video we're going to be focusing on the difference between individual, couple, and family therapy. Okay, so the previous video looked at trying to find the right therapist for you, and now it's really important to understand the different types of therapies. So thank you so much for the messages on Instagram. I feel I am answering some of them. And then next week we'll be moving on to book reviews as well as a bit more theory. Okay, so let's start out with the individual psychotherapy. What is individual therapy? So it's important to understand that the focus will be on the actual individual in the client. It's very different to a couple or a family, where the focus will be on the couple system, and then the family system, so relationships. So in individual therapy, the focus is on the development of a one-to-one relationship between the therapist and the client. The client is then invited into a self-reflective process through their own emotions and behaviors and patterns that they engage in to look at what could be working and what isn't working. So the focus would then be very different in individual therapy, and it's based on one person and their narrative or worldview and how they narrate their world. So how do they see their world? The focus is on understanding one person's worldview of the current problem, their role in the problem, and how they think they are viewed by others. In individual therapy, a collaborative, trusting, and open relationship has to be maintained and developed between the therapist and the client to be able to really look back right to the unconscious patterns of behavior, childhood, as well as current levels of functioning. And through that, the therapist can look at the client's blind spots. So those blind spots are those things that we don't see in ourselves, that even therapists have to see their own therapist to access. So if you think of yourself as driving in a car, and every time you have to signal to turn left or right, you have to also check your blind spot to see if there's anyone coming that you could possibly hit or they hit you. And it's a very similar concept in psychodynamic therapy, where you have to look very deeply into, with the help of an objective person, into what could be happening, especially unconscious aspects of what leads to self-sabotaging or any type of self-destructive behavior, from a core wound or a self-belief that you can explore in individual therapy. So in individual therapy, it's like going back to what we call the scene of the crime or a ghost in the nursery, as to where this pattern of behavior originated and how it is affecting current patterns of behavior. So for example, a neglectful parent causes one individual to grow up and be afraid of intimacy, or they, in adulthood, start to push people away or choose people that are neglectful as a pattern of behavior that was previously unconscious, but it becomes conscious in a segment of catharsis, which we speak about in psychotherapy. And that is what we call a trauma bond, which we'll speak about in another video. So most of our relationships that we have in our unconscious world that will be explored in, and it will be made conscious through a therapy program individually to understand those core wounds that come from trauma and a trauma bond in childhood. As we enter into couples therapy, there's a very, very big distinction. The couple itself is the client. So the relationship or dynamic or pattern between the two people, or what we call the actual client in the room. So we're not doing individual therapy between two people in the couples therapy space. We're looking at the whole relationship. The therapist in this space is generally more direct in entering the couple's way of life, observing their communication, daily routine, the style and way of relating, the way they resolve conflict, and their measures of distance and closeness. The therapist will observe and offer feedback about this dynamic and interactions within the couple. And so this is more intensive as both partners are invited to co-create a new couple process. So the interpersonal dimensions between the couple are addressed and spoken about. So this will be like a dance between the two. So it's an ebb and flow, attention and release. I often say that, attention and release, ebb and flow. So some of the things that will be explored are what brings the couple together, what brought them together in the first place. How do they manage their conflict and repair the conflict? Do they ignore it? Does one person avoid and the other become very anxious? What are the roles that they take on, and what are the roles that are expected? And what are their triggers from childhood that are being reenacted in adulthood, which we call, and what I use is the imago therapy. So as we looked at the client being the couple, and both are being asked to co-create a new way forward, to communicate and correct together. And also what this entails is that you both being invited, both members of the couple system are being invited to look at your role in the problem and any type of self-reflection of what you bring from previous relationships and your childhood into the things that trigger you, so that we can start to communicate that to the other party, the other partner, and help them to test their assumption. So for example, if one partner pulls away to give the other partner space, if someone in the partner dynamic has a neglectful wound, as in they were very neglected in childhood and left alone, they would feel very abandoned. But if they test their assumption with the partner may, for example, say, well, I was giving you space because that's what I would have wanted. So through that communication, we can heal a lot of those assumptions. So the relationship is again the client, and we would look at when did the problem start and how each of them start to play a role into that problem, and how we can look at the strengths and weaknesses of the couple. Now we're going to go into family therapy, a very interesting group dynamic where the family system is seen as the client. So again, we're not doing individual family therapy. We're looking at the entire system and how they got to come into therapy. So every family system will have a communication style and how they solve or hide repressing problems. And those will be analyzed, and any barriers towards problem resolutions will be looked at within the family therapy space. So things like boundaries will be looked at, as in how close a family can be together, as in how involved are they in each other's lives. So a clear boundary is, I know more or less what's happening with the family, but we don't get over involved and allow them to be individuals. So a healthier dynamic would be a sense of belonging and individuality. But sometimes we have boundary systems that are a bit more enmeshed, where they're too involved or too distant, where there's not much engagement and not much knowledge into what's happening in that family system. The other aspect of family therapy is to look at the roles in each of the family dynamics. All of us from our own families carry roles that we sometimes are very unconscious about, and we didn't realize that we carry into our family systems, as well as other social scenarios. So the more you become aware of this role that you play out, the more you'll be able to see why you put in that role or took on that role, and why you're reenacting or recreating that in other scenarios. So we have different types of roles in the family, but this is not an exhaustive list. It's just some of the common ones. So we have things like the peacemaker or the mediator. So this type of person is a person that's like the mini psychologist in the family, or a mini counselor or social worker, where they try to mend the family dynamics or help people speak to one another to bring the family closer instead of apart or in chaos. Then we have the mascot or the clown, so the one that makes light of difficult or high discharge situations. So, for example, Will Smith wrote in his new autobiography that he was the clown in his family system, and he did that because his father was very abusive and scary when he was very young, and in order to maintain the family system, he tried to be the clown. Then we have the caretaker, or sometimes the enabler, of types of roles in the family system where there's perhaps a bit of manipulation, or things like that, where a parent or even a sibling could enable certain types of behaviors in others. Then we have the martyr, who is in a disempowered or a victim type of state. And we have a scapegoat or black sheep. And then we have the nurturer as well as the truth teller. So in family systems that are high drama, so we call them high dramatic families, you always have at least one truth teller. And normally the truth teller of the family system is the one that's going to get the hit of why are you bringing up all the stuff that's being repressed. We also in family therapy look at implicit and explicit rules that are happening in every family system. So the implicit rules are the unwritten or unspoken rules about a family, where they have expectations regarding communication, closeness, and the organization. So, for example, an unwritten rule could be that a family is not allowed to talk about problems out in public or with extended family or friends. So it's very frowned upon. So it's not really told at the dinner table, don't tell other people what we're saying. It's just an unwritten rule that is expected. Then we have an explicit, which is a clearly defined, verbally spoken rule. So that's like saying to someone, never speak up to your grandparent, or don't speak up to an elder. Don't speak out to your father. So these types of things are what topics are acceptable to discuss and with whom. And all of these rules help the family and members in a relationship predict others' behaviors. And it's important for the survival or the homeostasis, we call it, in a family system to keep it together. That's why a lot of people in family systems, they panic when one of these rules are broken, because it threatens the homeostasis of the family. Some of the goals in family therapy would be to identify the strengths and the weaknesses of the family system. So what is working in their communication, in avoidance, or in going through to try and fix the problem. And usually in a family system, we always have at least one identified patient who the family identifies as being the problem. So in families where there's a lot of unconsciousness or there's not a lot of awareness, there's always one person that is targeted as being some type of problem. So they obviously don't follow the narrative of what is expected in the family, and they are very representative symbolically of what the broader family problem is happening or what's occurring. So for an example would be if you have a family system where one member of the family is identified as the identified patient and they have anorexia, it could be hypothesized, I'm just giving an example, but there could be other things, that anorexia is displaying the family's problem with too much or too little control, because anorexia is often about control with food and power. In family therapy, there's a range of techniques that the family therapist is going to do in order to perturb the system. So we actually want to make the family really uncomfortable in its homeostasis in a gradual process in order to shift the whole pattern of relating. So in family therapy, we can use either indirect or direct tools to be able to do that. So often things like moving people around at different seats around the room will shift the air or the new wave of the dynamic in the room. So if you find that sometimes if you go to a lecture or when you're in school, if you go to church or things like that, you get very used to going to sit in a particular seat and it gives you comfort, right? But if you go every week to family therapy and you're used to sitting maybe away from the therapist, and then the therapist says, please can everyone swap seats? And a particular technique is, for example, someone that doesn't have a lot of power or voice in the family will be asked to sit right very near to the therapist or in the therapist's chair. Or, for example, if two parents are fighting and one of the kids is trying to mediate between the two and they actually sit between the parents, the therapist could ask that child or adult teen to move and get away from the triangulated space. And it's actually purposeful to perturb the system and make them uncomfortable to start to get to more healthier family dynamics. There you have some of the differences. It's a very, very, very simple and brief summary of individual, couple, and family therapy. But there's much more to it than what you would think. You just think you're going to either speak to somebody and solve your problems or gain insight individually. And then in a couple, you're just working out communication patterns. But there's so much more, as well as in family therapy and family systems. We forget that all these roles, even sibling order as being the eldest, middle, and youngest child or only child, carries implicit meanings into our adulthood. And it's so important to analyze these roles because we perpetuate them in adulthood. And they cause us distress if we don't know why we do the things we do. E.g., if you're a people pleaser in childhood because you were a parent pleaser and you couldn't get that right, you could become in danger of trying to people please in adulthood, and you just become so exhausted. So it's so important to enter into analysis, even in group therapy where people give you feedback as to how they perceive you in the group. It sheds so much light into your current functioning and happiness level. I wish you all the best on this conscious journey, and I hope this video helped a little bit in starting that. All the best.